Okay, let's unpack this. Ever wondered if your address impacts your health more than, say, your doctor visits? Or if public policy is just as important for well-being as our personal choices?
It's pretty fascinating, actually, how much the world around us, what we call the social environment, really shapes our health. And often it's quite independent of individual risk factors. It's a profound influence, really.
So today we're doing a deep dive into some sources that explore exactly that. We're looking at everything from historical sociology right up to modern epidemiology, trying to get to those surprising nuggets of how our communities quite literally make us sick or keep us healthy.
Right. And the social environment itself. Well, it's quite a broad concept. It covers the groups we belong to, the neighborhoods we live in, the dynamics at our workplaces, and the policies, the systems that structure our lives. It's really a constant interplay between natural elements, man-made structures, and the social processes happening within and between groups.
Okay, so if this social environment is such a powerful force, how does that change how we usually think about health prevention? Is it still all about individual choices?
That's a really critical question because, traditionally, prevention often focuses on the individual. Things like smoking cessation programs or encouraging weight loss, right? Personal responsibility. But this social environment perspective, it shifts that focus entirely. Instead of just targeting individual behaviors, the point of attack, as some sources put it, moves to the environment itself.
Ah, okay, so like what?
Think about things like cigarette taxes or advertising regulations or creating safe bike lanes, community policing initiatives. These are place-based structural approaches that can influence an entire population, often for much longer, because they shape the world people actually live in rather than just asking individuals to change their habits within maybe a challenging environment.
That's a huge shift in thinking. Where did this idea even come from? What were the earliest sort of inklings of this?
Well, it has surprisingly deep historical roots. Some early work by Emil Durkheim back in the late 19th century, looking at suicide rates, was really groundbreaking. He showed rates differed significantly by locale, and importantly, they persisted over time, which suggested the social environment itself created a kind of social reality, something bigger than just the individuals in it. Society itself could make us sick, essentially.
Wow.
And then later in the 1920s and 30s, you had the Chicago School of Sociology people like Park, Burgess, Worth. They really dug into how these social forces worked at the neighborhood level. They saw cities as living laboratories, you could say, and they developed concepts like social disorganization, basically, a breakdown of social controls and zones of development, distinct urban areas with their own social dynamics. And here's the really profound takeaway from their work. They showed that a community isn't just a collection of individuals. It develops its own characteristics, its own reality that influences everyone there, sometimes more powerfully than their individual traits.
That's fascinating history. So how do these ideas, these insights from the past show up today? In modern epidemiology, for instance?
Oh, they absolutely still resonate hugely. We see studies finding that a community's overall socioeconomic status, its SES, is strongly linked to mortality and morbidity, and critically independent of an individual's own SES.
Independent.
Really?
Yes.
Yeah.
Take the Alameda County study, for example. It shockingly found that just living in a poverty area increased mortality risk, even if you yourself weren't poor. It even suggests the environment could sometimes sort of overwhelm individual factors, like it had a leveling effect on physical activity for some people, regardless of their income or race.
Wow. So it's not just about broad economics. What about other social structures? Things like discrimination or income inequality. Do studies show links there too?
Absolutely. There's demonstrable evidence linking structures like discrimination and racial segregation to poorer health outcomes. You see it impacting things like Black infant mortality rates, for instance. Income inequality, too, is consistently linked to worse health across populations. The thinking there often involves its potential to erode, social capital.
Social capital.
Yeah, that sort of web of community networks, shared norms, trust, the things that kind of hold a society together. Inequality can fray that fabric.
Okay, so we've talked community SES, social structures. Can modern research get even more specific? Look beyond just census data at the actual, lived environment.
Precisely. And that's where a lot of the really interesting current research is heading. It's moving beyond just broad demographics. Researchers are now measuring the actual quality of the environment in detail, looking at things like the availability of local services, crime rates, litter, urban violence, tangible things. And these studies are showing strong associations with outcomes like depression, how healthy people feel, and even poor pregnancy outcomes.
So given all these powerful connections, these associations, what's the next step? How do we move from seeing a link to proving cause and effect?
That really is the core challenge now. We need much more research to pin down the specific mechanisms. How exactly does the social environment get under the skin to affect health behaviors like smoking or physical activity? And this involves tackling some pretty significant methodological hurdles.
Like what?
Well, moving from just seeing an association to actually proving causation, and crucially, figuring out how to separate what's due to the individual from what's due to the area they live in. It's tricky, right? This often means using complex statistical tools like multi-level modeling. These help researchers carefully disentangle those individual versus environmental influences. And getting this right is absolutely vital if we want to design public health interventions that are genuinely effective.
So the next time you think about health, maybe consider this. It's not just about your personal choices, is it? It's also deeply tied to the intricate web of your social world.
Exactly. It suggests that designing healthier communities isn't just about running individual programs. It's about fundamentally shaping the very fabric of our shared lives, from policies right down to neighborhood resources.
Which leaves us with a provocative thought for you.
Yeah.
How might understanding your own neighborhood as a system change how you think about your own health, or maybe even how you engage with your community?